Skin lesion excisions. The most common type of skin lesion excision is called an excisional biopsy. This is where the skin lesion of concern is removed and sent off for pathologic analysis. So that's the most common way it's done. Another way to do it's called an incisional biopsy. This is where the lesion is not completely removed, only a portion of it is removed to send off and get a pathologic diagnosis. Another type of excisional biopsy would be wide local excision. This is excision of a skin lesion with a margin that's determined by whatever the skin lesion is proven to be. In other words, if it's proven to be basal cell or melanoma or any other type of skin lesion, once we have a diagnosis, we may need to perform a wide local excision, which based on the type of cancer as well as the depth, the amount of tissue around it will be determined because it varies based on the pathology and the depth. So a wide local excision is generally reserved for skin lesions with a known diagnosis that require a specific margin to be excised. Despite whether it's an incisional biopsy, an excisional biopsy, or a wide local excision, we always close the wound afterwards, and that involves multiple different techniques, perhaps a simple layered closure or a skin graft or a flap, and that is all described elsewhere in different videos. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.